Millions of people worldwide struggle with urinary incontinence, a condition marked by the involuntary loss of urine. While it's often associated with aging or childbirth, did you know that stress can also play a significant role? Today, we'll delve into the surprising connection between stress and bladder health, exploring how this common experience can impact urinary control and what you can do about it. Before we dive in, what exactly is urinary incontinence? It's a condition that causes an embarrassing and sometimes overwhelming leakage of urine. But it's important to remember that you're not alone. Urinary incontinence affects millions, and understanding its causes is the first step toward finding solutions. Now, let's talk about stress. We all experience stress in our lives, and while it can motivate us, too much of it for extended periods can negatively affect our health, including our bladder health. When we're stressed, our body activates the sympathetic nervous system, which triggers the release of hormones like adrenaline and cortisol. These hormones are designed to help us in short-term stressful situations. They increase our heart rate, tense our muscles, and redirect blood flow to help us fight or run away from danger. However, when this response is activated chronically due to long-term stress, it can disrupt normal bodily functions. One way stress impacts our bodies is by making the pelvic floor muscles tense. The pelvic floor is a group of muscles that support our organs, including the bladder. When these muscles are constantly tense due to stress, they can lose their ability to relax, which affects the bladder's capacity to expand and store urine. Additionally, the heightened state of alertness caused by stress can make it difficult to relax and go to sleep, disrupting the body's natural sleep-wake cycle. This disruption can lead to a decrease in the amount of urine produced during the day, but an increase at night. Furthermore, stress has been found to increase abdominal tension, which can put extra pressure on the bladder, leading to leakage. Interestingly, the relationship between stress and incontinence is in other words, not only does stress affect bladder function, but bladder problems can also cause stress. Experiencing urinary leakage can lead to anxiety and feelings of embarrassment and shame. These negative emotions can then trigger or worsen stress levels, creating a vicious cycle. Several factors can amplify the impact of stress on bladder health. People with generalized anxiety disorder or those who have difficulty controlling their anxiety may be more susceptible. Additionally, individuals with poor sleep or insomnia are more likely to experience stress-related bladder issues. The type of diet can also play a role. Consuming a lot of caffeine, alcohol, or carbonated drinks, which are common bladder irritants, can worsen urinary symptoms. So how can you tell if your stress is causing urinary problems? Here are some indicators to watch out for. Do you experience leakage during emotionally tense moments like public speaking or performing? Do your bladder symptoms worsen during particularly stressful times in your life, such as during exams or before important meetings? Or do you notice that urinary issues arise after a traumatic event or period of high stress? If you answered yes to any of these questions, it's possible that stress is contributing to your bladder problems. The good news is that there are many effective ways to manage stress and reduce its impact on your bladder health. Techniques like meditation, deep breathing exercises, yoga, and mindfulness can help regulate the sympathetic nervous system and promote relaxation. Engaging in regular physical activity can also help alleviate stress and strengthen the pelvic floor muscles, improving bladder control. Cognitive behavioral therapy, or CBT, has proven effective in reducing anxiety and creating habits that support bladder control. Strengthening the pelvic floor muscles through Kegel exercises can also be beneficial. A healthy diet, staying hydrated, and avoiding bladder irritants can further support bladder health. Some natural supplements containing herbs like Croteva norvala, echinacea, or magnesia may also offer assistance. If symptoms persist, it's essential to seek medical advice. Healthcare professionals can recommend treatments such as antimuscarinic medications, pelvic floor, physical therapy, hormonal therapies for menopausal women, behavioral interventions, or in severe cases, surgical options. Finally, don't overlook the emotional toll of incontinence. Reach out to support groups, talk to professionals, and consider counseling to improve your mental health and overall quality of life. Living with urinary incontinence can be challenging, but it's important to remember that you're not alone. By understanding the connection between stress and bladder health, recognizing early signs, and taking proactive steps, you can regain control over your bladder and your life.